Hello, I'm Zoe. I'm a transgender woman from near Bristol in the United Kingdom. I've not talked to you for quite a while, but here is my latest video giving a little bit of update on how I am. Well, over a year ago I had a vulvoplasty rather than a vaginoplasty, and I'm pretty well recovered from that. In fact, it wasn't that difficult. There's not an awful lot to say. But I also thought I'd like to show you what I look like without this wig, which I always use when I performed, if that's the right word, in my previous videos. And you can see me either with my hair as it naturally is, or wearing a little cap or hat. And we can talk in those terms. But I did have a chat with Mr. Inglefield last December about the merits really and why he would recommend a vulvoplasty or a vaginoplasty. The clip's not very good because he had to wear a mask because of the pandemic. When I tried again in June, when I saw him, well, the same still applied, so we didn't do it. But here it is anyhow.
The decision to have a cosmetic procedure, cosmetic genital surgery or vulvoplasty is really dependent on the patient, whether they have a desire to have vaginal intercourse or to have a vagina in the long term. And as reconstructing the vagina or having a vaginoplasty is a big part of the procedure, and it actually is the part of the procedure that carries the most amount of complications, then it makes sense, if there's no desire to have a vagina or to use that vagina in the future, that you avoid that risk.
Surgery. What extra care do you need to take with someone like me?
With any patients who are over the age of 50, for example, we obviously need to make sure that not only is it appropriate to do a particular procedure, but it's also very important that we make sure that their health, so that means their heart and their lungs, and they don't have any blood problems, in order to ensure that the surgery itself is safe and that patient is able to recover fully. So, we do all the full checks and blood tests and the ECGs, and some patients we need to get a cardiology opinion on, depending on their age and their history.
Yeah. So, what would you say to any trans woman contemplating having gender confirmation surgery when they're approaching it?
Yeah, I think it's such a personal choice, that it's about providing you with what you can feel comfortable in carrying on your life as you wish, and ensuring that we do everything to keep you safe during that whole journey. And for me, age is not a barrier. I've done full gender confirmation surgery on patients who are in their late 70s, because that's their choice. So with most surgery now, with modern anesthetics, etc., age is not really a barrier. It's about overall fitness and health.
If you had to guess, how many of these procedures have you performed during your career? Over what period of time, roughly speaking?
Over the last 20 years, have been about 500 patients.
For gender confirmation surgery,
Yes.
or for all?
For gender confirmation surgery, yeah.
Goodness me. Well, I can't thank you enough for what you've done for me. It's psychologically, profoundly affected me and strengthened me. Is that unusual?
That is lovely to hear, because that's exactly what we're trying to achieve, is to support our patients in order for them to be able to live the life that they want to live, and be comfortable in themselves. So here is me talking with no wig, no head covering on at all. I've been wearing a wig much less often. I often wear this hat, which you can see how I look here. But what I really want is to get hair implants here, so that I can just walk around with my hair, as normal, be normal. And then you can see me with my hat on, which is what I most regularly do as I go around and about everywhere these days.
the difficulties I face feel much more linked to the easing of the pandemic controls and regulations now that I'm once again in much more contact with the general public. And I had an incident the other week where it was very, very unpleasant. I was in a lovely area of Bristol, Clifton area, and I was standing on the corner and a vehicle turned in, highway maintenance vehicle, and the driver started laughing at me and insulting me and ridiculing me and slowly drove away. I reported it to the police, and they were sympathetic, they were kind, but they did absolutely nothing. And I've reported it to the local Green councillor there, who says she will talk to me, but that hasn't happened yet. Maybe it will. But it's worrying and it's distressing, and it's coming at a time when I'm feeling awkward. One of the main difficulties, of course, is my height, 6'2", which I can't do anything about, and my voice, which is evident from talking to you. I don't talk up here. I don't actually make an effort to sound more feminine because I don't yet feel I can accomplish that and sound authentic. So I've got a recommendation from my surgeon, Mr. Inglefield, as to who might be a good person to talk to about getting surgery on my vocal cords. We'll see whether I feel I must proceed with it. I'm quite nervous about that. Well, thank you very much for watching my video, and I hope to see you soon. Thanks very much, and bye-bye.